Just think about this. You're a young athlete, thriving, full of energy, could be at risk for an overuse injury without even realizing it. These injuries are subtle, gradually building up over time, often going unnoticed until it's too late. But what if you just had the knowledge to prevent them? Today, we're exploring essential strategies to safeguard that child's sports career from overuse injuries. So tune in to learn how to keep your athlete healthy, active, and in elite form. What's up, guys? If you're new here or you don't know me, my name is Dr. Cam, and I'm a double fellow and residency trained sports, orthopedic, spine, and manual physical therapist, as well as a faculty member in a doctorate of physical therapy program. On this channel, I provide you strategies and tools to throw hard and stay healthy. So let's dive into our topic with a closer look at overuse injuries, focusing on both pediatric athletes ages 6 to 12 and adolescent athletes ages 13 to 18. Overuse injuries are a result of repetitive stress without sufficient recovery, often linked to training errors, improper technique, excessive sports training, inadequate rest, muscle weaknesses, and imbalances. Number 1, understanding overuse injuries. These injuries often stem from early specialization in sports, leading to imbalances and weaknesses in muscles not regularly trained. Typical examples include tendonitis and stress fractures, which develop from this repetitive application of load on the tissues underprepared for that stress. Point number 2, importance of injury surveillance. A robust system for tracking and analyzing these injuries is crucial. Research shows that increased surveillance helps in developing targeted interventions that reduce injury rates. Healthcare providers like myself must be trained to recognize and report these injuries accurately. Point number 3, pre-participation physical exam, also known as a PPE. A thorough pre-participation physical exam must assess each athlete's risk factors such as muscular imbalances, flexibility deficits, reference to the Tanner stage to gauge maturity. This examination should be meticulously linked to injury surveillance data to spot trends and implement prevention strategies effectively. I've been to multiple PPEs for schools, and I will say some are really good, some are just bare bones. Point number 4, identification of risk factors. Early warning signs such as arm pain, fatigue, and decreasing throwing performance must be recognized promptly. Athletes showing these signs should reduce their pitch volume immediately, and additionally, anatomical factors like leg length discrepancy, genu valgus or varus, pelvic rotation should be evaluated as they predispose the athletes to types of injuries like so. Point number 5, coach education and medical supervision. Education for coaches, parents, and athletes about these symptoms and prevention of overuse injuries is vital. Coaches should hold certifications that ensure they have knowledge related to youth sports. Medical personnel trained in sports medicine should always be available as a referral source for all teams. Point number 6, sport alterations and limits. We need to advocate for policies that limit the volume of repetitive sports activities. Recommendations include not exceeding 16 to 20 hours per week of vigorous physical activities for pediatric athletes, and ensuring that they do not participate in multiple teams of the same sport per season. I cannot repeat that enough. Point number 7, training and conditioning programs. Conditioning programs should be planned with an emphasis on general fitness and sport-specific skills, beginning at least 2 months before the season starts. And progressing in training volume should not exceed 10% per week to avoid sudden increases in load. Point number 8, delayed specialization and diverse sports participation. Encouraging multi-sport participation and delaying specialization until later in adolescence can significantly reduce the risk of overuse injuries. Time off between seasons is essential to allow for physical and psychological recovery, but you parents can barely take a month off. And that's a wrap on how we can prevent overuse injuries in youth sports by implementing well-researched strategies and detailed assessments. I hope this guides you and helps you keep your young athletes safe and thriving in their sports careers. And just remember, I'm Dr. Cam, and I got you.